so much, Nick. And hopefully I'll stay on time. As she well knows, I often talk way too much. So I'm going to try to keep myself going quickly through the slides. Because
I don't have my hook to take you off stage, but no.
You don't. But like I said, I'll do my best. I might skim over some and dive into some stuff a little bit deeper, but we'll have time for questions afterwards.
Yeah, no problem. Take as much time as you need. You're good.
Great. I've already kind of given you some background of how I got into this field. When I first started doing research, back in 2007, I usually have to start a presentation by saying that I'm not a pothead. There was always an assumption that researchers in this field were not only researching the product, but also partaking of the product. And if you notice the steam in the background, it's not a volcano of cannabis oil. It's a humidifier for myself. But, I'll be, very forthright. Do I use cannabis to help me with sleep issues at times? Yes, I do. Do I use it to deal with some chronic pain that I experience? Of course I do. I have been grounded in the area of complementary medicine for a long time. And I'm always looking for alternatives to pharmaceuticals that come with their own side effects and potential adverse effects. So that's just a little bit about me. And now we're going to just jump right into it. I do want to throw out there my disclosures. This is a very tricky field to be in. It's very important that if you're working with anyone around medical cannabis, that you do have a conversation about any of their conflicts of interest. As a researcher in Canada, I have been very clear to keep myself as removed from industry as possible. And the only disclosure I have is that I am Deputy Director of CCIC, which is a national nonprofit organization focused on advancing research and science. And we no longer, since legalization, accept any funding support from the cannabis industry. So I'm just going to throw this out to you. There was a little mention of stigma at the beginning of this presentation, of just thinking about what comes to mind when you first hear the word cannabis. And I've thrown up, for those of us that are older, I threw up some of the images and words that often kind of pop up, and at least were popping up even, 15, 10 years ago. And a lot of these images are arising from prohibition, where we saw in the 1950s, movies being released, supported by governments in North America, things like Reefer Madness, that really kind of promoted this image of cannabis as being the devil's, weed, that it would lead to dysfunction in society, that people that partook of cannabis would end up, falling down a path of disrepair. And there's a lot of focus on the criminalization of cannabis and cannabis use, cannabis production. There's a picture of a grow up there. And then within, our society, we saw cannabis being used by people that, again, were often perceived as being at the margins or pushing our limits, like Snoop Dogg, who now is very mainstream and doing a show with Martha Stewart. So how things have changed, right? And then in acknowledgement of it being 420, which used to be our holiday to push for change around legalization, around laws that make sense, that did not criminalize possession, where often the harms of criminalization were worse than the actual harms associated with cannabis use. For example, not being able to, work with children, not being able to go into health professions, having a criminal record, not being able to travel, not being able to, actually get hired as a job. And so we often would see these sit-ins, often with young individuals smoking very large joints, puffs of smoke everywhere, usually at legislative grounds, trying to push that agenda. Now, there's been a lot that has changed. But we often forget, and especially for those of us that are health professionals, we haven't had a lot of exposure to where cannabis came from thousands of years ago. And cannabis as a plant was used as part of traditional Chinese medicine. It was used as part of Ayurvedic medicine. And in the 1800s, we saw it being used as an actual tincture as part of folk medicine or local medicine that was within North America. But in the 1900s, when society started to kind of get concerned about the impact of substance use, particularly related to the use of opium, we saw cannabis without a lot of thought. It was really just one legislature that decided that, you know, if they're going to deal with opium, let's throw cannabis into the mix. And it got kind of caught up in this prohibition around substances. Again, without a lot of evidence around it, of is this a problematic substance? Does it belong here? Does it belong maybe closer to something like alcohol or tobacco use? And it's really taken us almost 100 years to really challenge that whole notion around the prohibition of cannabis. And it took one very brave individual, Terry Parker, who was living with epilepsy, that really went to town on the Canadian government and said, this is unconstitutional. My liberty is at risk from using a substance, cannabis, that is helping me live my life and have a good quality of life. And that resulted in us seeing Canada become one of the first countries in the world to actually develop a medical cannabis program back in 2001. Now, it's gone through a lot of revisions since that time, I think about 4 of them. And then in 2018, we saw not only the medical cannabis program be maintained, we then saw the legalization of non-medical cannabis or recreational cannabis. And our medical cannabis program is actually embedded as part of the Cannabis Act. And I think it's really important to note, and hopefully if we have time, I'm just going to mention at the end of our presentation that the medical cannabis program in Canada is actually up for review at the end of this year and into 2023, where the Canadian government is mandated to actually review the policies and the program and seek consultation to see if any changes are needed to how medical cannabis is produced, distributed, and accessed here in Canada. Just a little quick chat about Cannabis Act and the regulations. This is a federal document. Federally, you have to be 18 years or older to use recreational cannabis. You can purchase it from a licensed producer, or you can grow it with limited amounts at home. I can't remember them off the top of my head, but I think it's like 4 plants inside. I think you can grow a few more outside. And you're allowed to have 30 grams of legal dry cannabis or its equivalent in public. And there's a lot of really stiff penalties around engaging children with anything to do with recreational cannabis, because the whole point of legalization wasn't necessarily about building a market. It was really about limiting the harms of that illegal market and the harms to our youth in Canada. Now, just a little, wherever you are in Canada, you need to check your provincial or territorial laws, because it does differ in terms of the age at which you can use recreational cannabis, as well as whether you're able to grow it in your home. I'm in Manitoba. I have to be 19, and I'm not allowed to actually grow recreational cannabis. I am, though, allowed to grow medical, although that's in flux. Now, when you look at the medical cannabis, you can access medical cannabis if you have medical authorization, a form completed by either a physician or a nurse practitioner. And it used to be that not every nurse practitioner across the country could do so, but I think most regions now have allowed nurse practitioners, Quebec might be the one outlier, are able to sign off on those forms. You can grow it at home. You can designate someone to grow for you, or again, you can buy it from not a licensed produce, but a licensed producer. You're allowed to have a 30-day supply of that medical cannabis in public, and that's up to 150 grams. So you can have 30, from your recreational supply, if you choose, and you can have 150 of medical cannabis, and that's referring to dried. And what you typically do, and we'll get into this in a little bit more detail, is that you submit your form to a licensed producer. You're now allowed to select more than one licensed producer, and inform them what you would like to use, and then it's couriered to you. You can buy cannabis, obviously, from a storefront. If you're over the age of majority, it's considered recreational cannabis in that context. And you just need to be very conscious that, you shouldn't be buying that for someone that is underage or isn't able to legally, use cannabis. You really should be going through the medical program in order to do that. But what we're finding is more and more Canadians are saying it's much easier now that I know what I want to use to just go through the recreational market. But it can be problematic if you're trying to get any exemptions from your workplace and you don't have that medical authorization form. It's difficult, as I said, for people that are children underage. And if you're also trying to get third-party insurance or to claim it on your income tax. So that's why we have a medical cannabis programs, because of those exceptions. You know, and as I mentioned, we have seen a drop in people that have those medical authorizations in this country. It was around 350,000. It's now under, you know, getting closer to 290,000. And that's because we feel a lot of people are moving into that recreational market and no longer feel that they need to kind of have that authorization from their physician or nurse practitioner. And when we do surveys in Canada, most people say they're using it either to manage some form of pain, or they're using it for mental health issues, you know, very similar to what Haley was talking about in terms of anxiety. Some people have mentioned using it for ADHD, using it for things like coping with depression. So in terms of where we're at in terms of approved uses of medical cannabis in Canada, there's only really a select group of health conditions that have actually been approved by Health Canada as having sufficient evidence or warranting the use of medical cannabis due to the potential risks of that health condition. And so nausea and vomiting from chemotherapy is one of those. Chronic pain, neuropathic pain in particular from multiple sclerosis and cancer, anorexia, or being unable to eat, loss of appetite from HIV/AIDS, and then drug-resistant epilepsy, particularly in the case of pediatric epilepsy or Dravet syndrome, where you have hundreds of seizures often in one day. So, but there's a lot of off-label uses of medical cannabis. And I think this really just speaks to consumers, you know, patients, survivors, and thrivers like yourself, you know, where you're pushing the envelope and you're looking for alternatives to pharmaceuticals. We've heard that in our qualitative research where patients are saying, you know, I'm on a lot of medication already. They come with side effects. Maybe I'm going to try something else that maybe doesn't have the same level of side effects, maybe doesn't have the same type of potential interactions. And so we've seen a lot of patient communities kind of push these off-label uses. So, you know, using it for mixed forms of pain that might be chronic with neuropathic pain. We've seen it in multiple sclerosis with spasticity, anorexia and cachexia in cancer. Cachexia is when you actually are losing muscle mass. And then other things like chronic headaches, migraines, insomnia, the fibromyalgia community is even very predominant, trying to push for more research in this area, as well as PTSD and anxiety. But, you know, I want to take a little bit of a step back in terms of what is actual cannabis. And, you know, I always think it's important when we're talking about it, because a lot of what I'm talking about today is going to be focusing on that whole plant, that this is a plant, you know, that does grow. We have found it in the wild. You know, most of the times now it's produced by humans, but it is a plant and it's a very complex plant. It's comprised of over 110 active components that we call cannabinoids. But as a plant, it also has other components like flavonoids and terpenes. And we've had research on other plant products that have things like terpenes to know that these components all have an impact physiologically on our body. And I think that's always been the struggle when we talk about the lack of research around whole plant cannabis, is this isn't a single, you know, chemical structure that we see in a lot of pharmaceuticals. This is a very complex product that has a lot of different components in it. And our clinical trials aren't really set up to have something that complex. We usually want something that can be standardized, you know, that's very simple, and we can compare it to a placebo. And cannabis, because of its complexity, the fact that it can get you high, makes it really hard to blind people of whether they're consuming cannabis, particularly with THC, versus consuming some other type of herb that doesn't have that impact. The other thing that makes this really complex is, you know, cannabis isn't just used for medical purposes. It's used for recreational purposes. It's been used for spiritual purposes. So there's a lot of stigma around it. There's a lot of belief system around it. And there's a real culture around cannabis. And so trying to put that into kind of that, white room, black box of a randomized clinical trial has been really, really challenging. I'm going to dive into, I'll be honest, I'm a registered nurse, PhD prepared. I'm not a physiologist. I'm not a pharmacologist. And that's where I really, as Janik was saying, it's important to go and speak to your doctor, your pharmacist, your nurse practitioner, if you're really wanting to get, information that's going to be personalized to your health condition, as well as the treatments that you're receiving. But if we dive into the cannabinoids, I'm sure everyone that's here nowadays knows about the two main ones. It's THC and CBD, cannabidiol and delta-9 tetrahydrocannabinol. THC is probably the most well-known and has the most research on it. Most of it, though, has been focused on its potential harms as a recreational agent, and it's what actually gets you to feel euphoric or high. Cannabidiol, CBD, it doesn't have the same intoxicating effects, but it actually does alter your mood and your sense of well-being. So we no longer say it's not psychoactive. And, I've heard people call it, it's interesting. I love the way Haley was saying it's a quiet drug. I've heard some of my colleagues call it a dirty drug. And that's not to say that it's bad. It's just a drug, a component that we're really trying to unpack because it seems to have really diverse effects in the human body. It doesn't just impact one type of cellular receptor. It seems to have a very multifocal effect. It also seems to affect enzymes in our body and hormones in our body. And so there's a lot of research trying to unpack that. And I'll be honest, it's a hard slog to try to keep up with it because there's a lot going on right now. Some of the other minor cannabinoids that we're just starting to pay attention to is things like CBN, THCA, which is actually THC in its raw form in the plant, that when it's heated, we end up with that psychoactive THC, and then THCV, which all seem to impact different, again, cellular receptors in our body. And there's a lot of debate right now about, do these all interact together and have this synergistic or entourage effect? And it's been really challenging because there's been a real team of people around the world pushing that these all must work together. And we usually see that in plants, that they seem to have all the components work together in a synergistic manner. But it's made doing clinical trial research really difficult because now our funders are demanding that we have to isolate and test each of those interactive effects if we're going to do any clinical trials with the whole plant. And I think the jury is still out is how important is that entourage effect? And this will probably be research that will go on for the next 50 years, to be quite honest. So in terms of the human cannabinoid system, again, I don't want to get into a physiology lecture right here. I'm sure there's better people that are prepared to do that. But I think what's really important to acknowledge is that the endocannabinoid system is a regulatory system in our body. It's an endogenous system. We have these receptors almost in every area of our body. The CB1 receptors are typically in our nervous system, brain, organs, bones, and joints. And that's why we often see it being used to treat pain. And we also see it having that euphoric effect. CB2, in the other hand, as a receptor on our cells, is more found within the immune system, in the GI tract, the gastrointestinal tract, as well as our peripheral nervous system. And that's why we think, it potentially has more of a role in things like neuropathic pain, where you get those tingles, those pins and needles. But what's really interesting is that this balancing nature of the endocannabinoid system, it doesn't just cause one thing in our body. It affects our appetite, it affects our sleep, it affects our mood, our immune function, our body movements, our memory and learning. So sometimes when I have healthcare professionals that say, well, this is silly, cannabis is a cure for everything now. And it's like, well, the endocannabinoid system influences almost everything in our bodies. That's not to say that cannabis necessarily will be a treatment for everything or help us manage every symptom that's out there, but we have to acknowledge the pervasiveness of the endocannabinoid system in our body. THC as an exogenous cannabinoid. We have endogenous cannabinoids in our body, but when we consume cannabis that has THC, it tends to impact the CB1. CBD, as I mentioned, as this kind of dirty drug, it seems to impact CB1 and CB2 in different ways, but it also seems to impact other systems within our body as well that we're continuing to unpack. So that's the biology lesson for today. Let's kind of dive into a little bit about, and I'm focusing a lot on cannabis and cancer because I'll be very honest, there's not a ton on non-malignant conditions related to brain tumors in the literature. So I'm just going to give you a bit of an overview about where things are at with cannabis and cancer, and then we'll dive a little bit into where we're at with brain tumors. Just going to take a little sip though first. So just to give it a little bit of a context, up to 1 in 5 individuals living with cancer in Canada and the US report trying or using cannabis after their cancer diagnosis. And it's for a variety of reasons. We've mentioned pain and nausea, but people can use it for other symptoms, including things like anxiety and PTSD that we're now acknowledging that many individuals that have gone through cancer treatment and a diagnosis may be experiencing. But we also have to acknowledge that, cancer patients also come with other health conditions as well. They may come with mental health issues. They may have pain such as arthritis, and they may be, again, wanting to use something that's not a pharmaceutical to manage those health conditions. And what's really intriguing to me is that these individuals report being kind of hungry to get advice and information and evidence and be followed up by their healthcare team. They don't want to go out into the community and get this information. They really want this to kind of be embedded in the care that they're receiving. And, a lot of this has started from, again, the patient communities telling us that they're using cannabis and they're finding them to be helpful. And so there's a whole host of cancer and cancer treatment related symptoms that may be helped by different cannabinoids. And most of the focus, again, has been on THC and CBD. So with chronic pain, there's been a lot of focus in cancer and outside of cancer that it could potentially have a role, excuse me, in managing various forms of chronic pain. There's also some beginning understanding that CBD in particular may have a role in neuropathic pain that we are seeing people get from certain types of chemotherapy treatments. For nausea and vomiting, there's been kind of a long-standing interest in using cannabis and cannabinoids, particularly for people that have had kind of intractable nausea and vomiting or anticipatory nausea and vomiting that occurs before they go into a treatment center. And there's been interest in whether THC, CBD, and more recently, this raw form of THC, of whether it could actually be helpful. For a lot of people that are going through chemotherapy, radiotherapy, and even surgeries, they can lose their appetites, kind of like COVID, that doesn't taste as good anymore. Your smell and your taste changes. And so is there a role with THC? We often talk about the munchies. Does this help people feel more inclined to eat and hopefully maybe not lose as much weight? And there's also maybe a beginning role for THCV in that as well. And what's been interesting is there's also been a bit of research suggesting not only can it help people eat, but does it also help people with their cravings and have a role in obesity? So there's this very strange relationship with cannabis and food that researchers are actively trying to sort through. Other things like muscle spasms, seizures, which is probably, of interest to this community. There's a thought that CBD may have a role. And as Haley mentioned, there's also a great deal of interest that instead of using anti-anxiety medications, could someone use CBD? Doesn't have that euphoric effect. Could that have a role in managing panic attacks, night terrors associated with PTSD, and more kind of generalized anxiety as well? I want to dive into a couple of these a little bit more particular. Starting off with cannabis and cancer. A lot of the research that's been done, and one of the caveats is that most of the early research on cannabis has really been focused on pharmaceutical forms of cannabis, things like Marinol, Nabalone, and now the nabiximols. And there's a real interest now on the whole plants, but we haven't seen the same body of research come forward yet. But we're starting to see some systematic reviews, meta-analyses, and that's just where we're pooling all the research together. And because of the challenges in doing research on cannabis, I don't think it's surprising that we're seeing a lot of people tell us that, it's not the highest quality research. And we are seeing small to very small improvements in things like, pain relief, physical functioning, sleep quality. And so what we're seeing is that, in the qualitative literature and in observational data, patients are telling us, yeah, it doesn't completely control my pain, but I'm using it alongside my other medication to reduce how much perhaps opioids or other, pharmaceuticals I'm using, and I'm using cannabis, instead or as a complement, or I'm using it for breakthrough pain. And I think the real goal has been to kind of reduce the use of opioids and reduce some of the side effects of some of those medications. But, we need to do a lot more trials. We need to do some comparison trials where we're actually, comparing cannabis, whole plant, pharmaceutical forms with present day pain medication to actually see if it has an effect. Some of the interesting, though, bench research, mice model research that's been done is starting to point to this kind of little dilemma where there seems to be this biphasic relationship in terms of cannabis and it managing pain. And what that means is that it seems that at lower dosages of cannabis, it seems to be effective, and this is particularly referring to THC, it seems to be effective in managing pain. But as we start using higher amounts of THC, people are reporting higher levels of pain levels. And, I've got some theories around that. It's possible that we know that high levels of THC can actually increase people's anxiety in comparison to CBD. And so maybe people are getting more anxious and they're having, they're being more observant of their levels of pain and hence are reporting higher levels of pain. But there also could be maybe more of a physiological rationale to that, because this isn't the only type of product that we see this kind of biphasic relationship. So interesting work to pursue in the future. I mentioned neuropathic pain, that pins and needles, the tingling. Again, there's been some systematic reviews focused on that. Again, saying it's very low to kind of moderate quality evidence, not the highest quality trials that we've seen, but compared to a placebo, so that's not comparing it to another pain medication, it does seem that cannabis-based medicines may have a role in improving pain relief and global improvement around neuropathic pain. So there's definitely some promise here, but we probably need to do better quality studies, because sometimes low quality studies can be more promising than they actually are. So, for those of you that are health professionals or even researchers online here, there's a world of research that needs to be done. I also wanted to quickly touch on antiemetics. Sadly, most of the research has been done 20 years ago, before we had the Zofran and the ondansetrons that we now use for managing chemotherapy-related nausea and vomiting. Before we had these higher quality medications, cannabis looked very promising. When we now kind of compare it to what we have, it doesn't seem to be that helpful in either preventing it nor in treating it. However, there are for some individuals that these medications are not that helpful, or they have poor side effects, a lot of side effects attached to them. And so cannabinoids might be useful in that context. We also find that when people are in active treatment, while we don't always advise people to do an inhaled route, if they are having sudden onset nausea and vomiting, inhaling cannabis may quickly provide them with relief for a short period of time. So again, more research, but currently, groups like the American Society for Clinical Oncology are suggesting that cannabis is not recommended. But on that note, I just got invited to join the ASCO Clinical Practice Guideline on Cannabis and Cannabinoids. We're having our first meeting next week. And so I'm really excited to work with some world leaders in creating a cancer-related guideline on cannabis that hopefully will really advance our field and give us direction in terms of our research. And then just to kind of wrap up talking about cancer and cannabis generally, as Haley mentioned, a lot of people are using cannabis for anxiety. And we are starting to finally see some trials come out, not only in cancer, but in the general public, that suggests that CBD in particular can help reduce anxiety in people that have certain types of anxiety disorders like social phobias. We've also started to see some research in the veteran community to suggest that it could help with PTSD, in particular, preventing night terrors and helping people with their sleep. And then a colleague of mine, Marcel Baum-Miller, down in the US, just wrapped up a double-blind crossover study with 80 adults with PTSD. And he actually tested high THC, which we often don't recommend for anxiety, high CBD, and then a 1-to-1 ratio of THC and CBD. It's a small study, and what was interesting is that they didn't see any difference across the placebo arms, nor improvement to the placebo. But, was it the right amount of THC and CBD? We're not sure. 80 is a pretty small sample size, so I'm pretty sure Marcel will be continuing that line of study. And before we jump into brain tumors, I do want to quickly mention, I've had colleagues, not so much patients and family members say, cannabis can cause cancer. And I think they kind of equate it to tobacco. And what's been interesting is that we've had consortiums that have spent 20 years trying to show a link between cannabis, inhaled cannabis, and lung cancer and head and neck cancers, particularly among recreational users. We haven't been able to find that link. And the only link that's kind of been suggested in the literature is that chronic, use of cannabis, among recreational users may be linked in young men with an increase in testicular cancer, a germ cell cancer. And so that's the only caution I've seen around cannabis and does it have a link to cancer. But I have seen some cellular research that raises some concerns around things like cannabis and certain components and breast cancer formation, but that's in a test tube. And so we need to start doing those larger population-based studies, determine if there's any other risk that we need to inform the public about. Okay, I'm going to take a sip and then we're going to jump right into the brain tumor portion. So, since about 1975, there has been a wealth of bench and animal studies that have been conducted, on cannabis and whether it can be used as a treatment for cancer, not only gliomas and glioblastomas and astrocytomas, but also other forms of cancer. And there's a real thought that, when you put it into a test tube with cancer cells, THC and CBD, we see the death of cancer cells, apoptosis. We see an inhibiting angiogenesis, the growth of blood vessels towards tumors. It seems to prevent it from invading other tissue around it. Seems to act as an anti-inflammatory and an antioxidant. And there's some suggestion from Donald Abrams, formerly of UCSF, that it could potentially actually act synergistically with certain chemotherapy agents as well as radiation. So a lot of interest and a lot of promise. And I think this is where a lot of cancer communities have gotten really excited. And so the question that often comes to me is, does it cure cancer? And in particular, could it potentially be a treatment for brain cancer? And we've had numerous case studies, which are basically one individual that has used cannabis, that has had a unique prognosis, that has lived beyond their expectations, has had interesting imaging results that have been published. And, they're thought-provoking. They push us towards doing research, but they're an N of one. And there's a lot of variables that could explain, that positive outcome that we've seen. And so we really need to start moving into going back to the bench to see, does it kill various brain cancer cells, and need to start doing those trials with humans. And so when you look at the mice research that has been done, the mice research, we've started to see, again, Donald Abrams has done some work showing, what happens when we take THC and we add it to one of those chemotherapy agents for gliomas. And there has been some suggestion, again, in a mouse model, that it does seem to suppress the growth of those tumors, particularly tumors that have been resistant to chemotherapy previously. There's also been some bench research that suggests that when you combine THC and CBD in neuroblastomas, we also see some positive results in terms of cell growth, cell invasion. But what happens in a test tube in a mouse, doesn't necessarily translate into the human being. And so when we start looking at the human studies, Manuel Guzman from Spain is one of the real leaders in this field, and he completed the first intervention study where he actually inserted THC right into the tumors, but just with 9 individuals that had recurrent glioblastomas. He didn't see any difference in survival for individuals that were receiving chemotherapy alone, but the treatment was very well tolerated. And so, it kind of made people say, is this a pathway that we could kind of pursue? And then in further research that was led by Guzman, as well as by a trial that was done by the pharmaceutical company running Setivex, which is Dibiximols, which is that 1-to-1 oral spray. These 2 small trials, and they're with populations of about 20 people, showed a reduction in the actual size of the glioblastoma tumor. It also prolonged life. For some, it was up to 150 days. And then we saw that there was a phase 2 placebo-controlled trial with 22 patients, again, combining it with the chemotherapy agent. And again, we saw an increase in survival, and the mean survival days increased to 181 days. And so this was incredibly promising. It was a lot of excitement, and it's like, great, now we need to do, a trial of 400, 300 patients. And unfortunately, that hasn't happened yet. So it's really kind of stalled us in kind of moving forward. But there has been a little bit of progress. And I just want to point out that my colleague, Janet Schloss in Australia, has just completed a phase 2 trial looking at tolerability mainly, but also looking at whether there was any change on imaging results. Ideally, this would be a more long-term study looking at survivorship. But again, it was found to be very tolerable. They were using a 1-to-1 ratio to a 4-to-1 ratio of THC and CBD over 12 weeks. So again, pretty short term, but people reported better physical and functioning outcomes. They slept better. And they also, what was interesting is that while they didn't see any change in the size of the tumors between the 1-to-1 and the 4-to-1 ratio of THC to CBD, they compared it to a historical cohort of individuals that were matched on very similar characteristics around, their gender, their age, their disease state, their MRIs at baseline. And, they saw that people that received the cannabis treatments had an 11% reduction in their tumor size. Again, 88 people is very small, but a little bit more evidence suggesting that there's something going on here. We need to get that funding. We need to do those larger trials because there could be some potential promise here using THC and CBD, perhaps not independently, but alongside chemotherapy agents to maybe enhance their effect. But more work needs to be done. Now, I'm really conscious of time here, so I hope Jeanette gives me a little bit of grace, and I'm going to fly through some of these pretty quickly.
You're okay, Lynda.
Am I good?
Yeah,
okay.
Just, you don't have to fly through them.
Okay.
It's recorded, right? So if people need to jump off, they can come back to the recording. So I'd rather you get the information in, so no problem.
Great. Thanks for letting me know.
You're welcome.
So for some of you, you probably have used cannabis. This might be old hat to you, but for those that you're thinking about it or have questions about it, maybe some of this information will be useful. So just some real basics. Cannabis has really changed since the 1960s. It's not just about having dried bud or flower anymore. We now have oils, we have tinctures, we have a whole host of edibles out there, from gummies, chocolates, baked goods to beverages. We see a lot of patients moving away from using any type of dried, inhaled forms to using soft gels or using those oral sprays. And I'm just mentioning that in the rec market, we still do see concentrates, very similar to hashish. These are a little bit more problematic because they're very high THC. And if you're naive to using them, you could have problems. There's tons of variability around how much THC and CBD are in these products and the ratio of those. Some have almost no THC in it and are primarily CBD, and others are very high in THC and have no CBD, and some are very balanced. And that's why I always find it problematic when people talk about the harms of cannabis, and it's like, cannabis is very complex. And if you're using something that's primarily CBD, a lot of these harms you're talking about in terms of impairment don't really apply. But there's other things you need to be conscious of. And then there's always this question around cannabis strains and which one works best. And to be quite honest, this is something that comes from the culture of cannabis, where for years people had their favorite strains. I often say it's kind of like your favorite type of wine, that people like the taste, they like the smell, and they like the effect. And a lot of it has to do with the various terpenes that are attached to cannabis. But these cultivars, we don't know a lot about them. We have almost no research that suggests that they have varying effects. We're starting to see a little bit of research in Toronto around this. And when we actually look at it from a genetic perspective, we often find that these strains are all hybrids of each other, that, there's been all this botany going on and genetic kind of morphing of all these different strains, that we don't really have a lot of really pure indica or sativa strains. But that being said, there's an overwhelming number of consumers and patients telling us that they strongly believe that strains have different effects. And that's where we need to do a lot of research to understand, is it something about the terpenes, the flavonoids, how it's grown? Is there some genetic component to this? We need to unpack a lot of that there. But from a scientific perspective, we're basically saying, let's focus on the THC and the CBD at this time. Kind of related to this is the routes of administration. We have smoked forms. And again, as I mentioned, people use it because it has a very immediate effect, and it's often shorter lived, up to 4 hours. People can smoke it. We also see people moving towards vapes. There's a bit of concerns around vapes if you're using it with an oil-based cannabis product, because most of those oils are for oral consumption. They haven't been created to be inhaled, and there's a concern about lung damage attached to it. So we often recommend, if people want to vape, focus on the dried product instead. You might get less particulates than if you're using a joint. Again, immediate effect, short-lived. We're seeing a lot more oral products, as I mentioned. The one that's the newest on the market is the oral strips, that you can actually have these strips that you put inside your cheek, and it slowly moves into your bloodstream. Takes a little bit longer to have an effect, 30 to 60 minutes. And sometimes they can last longer, up to 12 hours. So we often see people doing this at nighttime when they're not worried about driving or going to work the next day or to school. We do see topicals as well. The market hasn't been as strong in Canada, but people are often using these for topical issues, perhaps like radiation burns, for skin cancers. We also see people using it for arthritis pain. Some really intriguing work going on in Toronto on this around wound healing, but we need larger trials to know if it's actually evidence-based. And suppositories are probably the newest way of using cannabis. There's one woman-led company that's created them. For some people with nausea and vomiting, this is the way to go. It'll be interesting to see the uptake in the community on this. Dosing, again, not a physician here, so I'm not going to be giving any advice out beyond the fact that you should start low in terms of your dose of THC if you're using THC, and slowly titrate up until you get the effect or the management of a symptom that you're looking for. And this is where you should be working with your healthcare provider in doing that. And we recommend that people do this not over hours, you do this over days, and you do it, hand in hand with a healthcare provider. And so we always tell people that, if you're smoking or inhaling it, you wait between puffs to see what the effect is so you don't take too much. And if you're doing something oral, you do it very gradually, especially if you're doing an edible, because if you consume too much, you're going to be stuck there for probably 8 hours feeling that way. So you want to be very cautious, and you want to kind of wait a couple of days to see how's that dose working for me before you think about moving forward. As Haley said, these can be quiet medicines, and they can have quiet kind of cumulative effects. The minimum therapeutic dose that we've seen, particularly working with palliative patients, as well as working for people with cancer, is starting at 2.5 milligrams of THC, if that's indicated for your condition. But as I said, there's a whole bunch of different reasons I won't get into we're all individuals. We all have different metabolisms, different diseases, different distribution of our receptors, and it impacts how cannabis affects us, as well as our history with cannabis. But this is not, I don't want this to come off as this is a benign drug. It has tons of side effects that we probably all know about, and if you're someone, that is living with a brain tumor or has had surgery, you may already have some of these issues: confusion, balance problems, fatigue, nausea, hallucinations. So just be conscious that if you're taking cannabis, particularly high in THC, you may have these symptoms exacerbated. So be very conscious of that. And there are some severe health effects that you need to be aware of. For individuals that are living with heart disease, we have seen some population-based studies suggest it could increase your risk of heart attack and stroke if you're living with heart disease. People can have tachycardia, rapid heart rate. They could feel their blood pressure drop suddenly. So that's where we see people, hitting the floor. And then we've already mentioned kind of lung health. And what's a really special one for people that might be undergoing chemotherapy is that if you're immunocompromised, you want to be really careful about using dried product that could potentially be contaminated with like bacteria, viruses, or fungal material. You really want to make sure you're going through the standardized market, not through illegal sources, and perhaps use oral, soft gels versus inhaling it, just because we've seen cancer patients end up with lung infections as a consequence. Hyperemesis syndrome, there is a strange thing in chronic users, especially of high THC, where everything's going along fine and then they start vomiting and they cannot stop vomiting. And so you may need to kind of take a break and work with your healthcare provider to see, if you're able to restart it. People can get very intoxicated. Cannabis hasn't been related to people dying. You have to be very cautious, obviously, with pediatric populations. We have seen children go into comas when they've consumed concentrates, used for recreational purposes. And you need to go to an emergency room if you feel that you either have hyperemesis syndrome or that you're highly intoxicated and no longer safe. And there is a mental health concern. We have seen that individuals that have a risk of schizophrenia are more likely to exhibit schizophrenia earlier if they're using high THC strains of cannabis. We do see sometimes an increase in psychosis and panic attacks, again related to high amounts of THC. And we have seen a moderate link to different forms of depression, which is, kind of contradicts some of the stories that people tell us. And again, I think that's where we need to tease out what type of cannabis people are using, THC CBD ratios, because it can really shift how it impacts your mental health. We're in the home stretch here, I promise. I'm not going to get into the details, but it's really important if you're using cannabis that you talk to your pharmacist, talk to your physician and nurse practitioner. especially if you're on other medications, because again, if you're consuming anything, it can interact with your medications, even if you're taking food. So things like blood thinners, they do seem to interact with THC and CBD. And obviously you don't want to have any bruising or bleeding as a consequence. If you're on seizure medication, CBD can actually increase the levels of those medications. So you're going to need to have that conversation and see if you need to balance things out a bit. And there's some beginning evidence. There wasn't any evidence before that it could interact with opioids, but there's some beginning suggestions that it can. And then some of the new immunotherapies, there's some, again, more cellular bench research suggesting it could interact. And so we need to be having those conversations with our healthcare providers. And obviously, if you're using alcohol, sedatives, anything else that depresses your central nervous system, cannabis can have a similar effect. So you just want to be aware of that. If you're wondering, how in the world do I access medical cannabis? Talk to your doctor or nurse practitioner. It's hard to raise these. Come at it from a very grounded perspective of why you want to use it, what's not working for you right now. If you see some evidence, bring it in to have a chat with them about it. And tell them that you want to do this with them. You want them to provide follow-up. You want them to be documenting what you're using. You don't want to be hiding your cannabis use. If they are not willing to talk to you about it, ask for a referral to someone that's knowledgeable and able to do that. If they won't do a referral, there are medical cannabis clinics in the community. You can often Google them and find them. The one caveat is that some of them do have relationships with licensed producers. You do not have to go to the licensed producer that they recommend, nor use the product they recommend if you're worried about any conflict of interest. You register with a licensed producer. You can now register across different ones if you want different products from those producers. You usually will tell them what type of cultivar or species you want or strain, how much THC, CBD, as well as the type of cannabis you want to use. And then it's delivered to your home, which is very convenient. Very quickly, I don't have time to go into all of this. You're allowed to use medical cannabis in a lot of different settings, but there's a lot of restrictions around it. If you're going to be out in public, make sure that you have your medical authorization information on you in case you're stopped about using cannabis, because you're often not allowed to use it in public places like stadiums, near children, and schools and play yards, on patios. And that's why people are using things that aren't as noticeable, like oral pills, using mouth sprays, using edibles. It's always safe to do it in your home, in your backyard, but you have to be a little bit careful if you're using inhaled forms and you're in a shared living arrangement like a condo or apartment. Things can get a little bit tricky. And again, having your medical authorization is always a good plan. Just again, touching on a few things. Medical cannabis is incredibly expensive. And that's why many people grow their own, and why we've also heard that people are still remaining in the illegal market despite some of the risks attached to it. We are starting to see more health insurers that will actually cover medical cannabis if you have authorization. Veterans Affairs is also covering it as well. You can claim it on your income tax, but that doesn't help when it's just still too expensive for many people to afford. And there are some licensed producers that provide compassionate pricing for people that are using it for medical purposes. A parent or a guardian, if you're online and you're wanting to use it for your child, you will need that authorization, and you are allowed to possess it and help administer it to someone that is underage. As I mentioned, if you're also dealing with someone that isn't, has cognitive impairment, an adult can possess it, pick it up, and also help that person use it under the Medical Cannabis Act. So I can't believe I got through that without barely coughing. That's incredible. Just a little FYI, there is so much research that needs to be done, and we're really at the beginning of it here in Canada. I'll be honest, we've struggled with legalization to get our medical cannabis programs off the ground. It's incredibly hard to get medical cannabis product for a clinical trial, but they recognize the problems and they're working at correcting them. But one thing that we've been able to do is do survey research and to talk to people like yourselves that are interested, trying to access it, or have accessed and used medical cannabis. We're doing the medical cannabis access survey right now. We want to hear from people. We want to hear what's working well with the medical cannabis program, what's not working well with the medical cannabis program, because the federal government is seeking input at the end of this year, and we want to be able to give them a report and hopefully go present to them. I'll be presenting on Friday. Health Canada will be in the audience. Our preliminary findings, we have 1,900 people already, but we would love to be higher than that. So we encourage you to think about taking part, no pressure, but we would love to hear from the brain tumor community around this. So, just to wrap up, more research, please. We need it to be made easier to be conducted here in Canada. I think cannabis and the endocannabinoid system has enormous potential for people living with brain tumors, living with cancer, trying to manage their symptoms, as well as look for innovative treatment. There's a lot to be seen, so stay tuned, engage your healthcare team, and stay up to date in the literature, because I'm hoping that there's going to be wonderful things to come. So thanks for the opportunity. My slides are going to be made available. There's some links that people can access and some additional resources for folks. So thank you, Janek, for being very gracious and giving me a little bit more time today.